Good afternoon and welcome to Alliance Live. Today we're coming to you not from our usual office, but from the Lighthouse in Glasgow, where we're holding a self-management event. We have some things underway at the moment and we're waiting for our participant Gillian Grochla, team leader at Pillar Kincardine, to join us. She'll be with us shortly, so do hold on and we'll come back to you in a few moments. Now we're going to turn to today's webinar. We are going to be joined by Gillian Grochla, team leader at Pillar Kincardine. Pillar Kincardine is an organisation that works to improve the mental health of people in South Aberdeenshire through a number of initiatives. And this week they actually won the award for employability at our Self-Management Awards, so congratulations to them. Much of the work of Pillar Kincardine focuses on making personal connections, encouraging people to manage their recovery and developing programmes with people with lived experience of long-term mental health conditions. But a key focus for the organisation is in strengthening connections with other agencies, adding value to the network of services available in the South Aberdeenshire area. There's a lot of development going on at Pillar Kincardine with new services in the offing. We're going to get into the presentation now. This is led by Moira Hurry, who is Service Manager at Pillar Kincardine, and by Gillian herself on the organisation's journey to integration. A reminder, of course, that you're invited to send us questions using the chat box within the toolbar, and we'll ask you questions after the presentation.
My name is Moira Hurry. I'm the Service Manager here at Pillar Kincardine.
And I'm Gillian Grochla, Team Leader.
We would like to start by thanking the Alliance for the opportunity to explain the services provided by Pillar Kincardine and reflect upon our journey towards integration and a real working partnership with local health and social care teams.
In 2011, Nicola Sturgeon stated, "We want to ensure that adult health and social care services are firmly integrated around the needs of individuals, their carers and other family members. We believe this is an idealistic but visionary concept and would, if realised, provide a much needed holistic and person-centred care system. In this presentation, we will give a brief outline of our service and an overview of our journey towards integration, which includes a perspective of a senior colleague in a local health and social care partnership.
Founded in 1989, Pillar Kincardine is a registered mental health charity based in Stonehaven, South Aberdeenshire. We offer an advice and support service to better well-being. Pillar believes that people experiencing mental distress can direct their own journey towards recovery and improved mental health. Our role is to give people the tools and the support they need for as long as they need it to achieve their goals. The organisation is co-produced by those using the service, local volunteers, and a small team of employed staff. Pillar enables people to achieve positive mental health through delivery of our 4 pillars of well-being.
With recovery in mind, we help people to build motivation and capacity to change by supporting them to take the next step in their recovery journey. We provide a variety of professionally designed and facilitated weekly groups and projects which bring people with similar experiences and challenges together in order to learn new coping strategies and build the skills they need to better self-manage their conditions. Minds at Work benefits people by increasing feelings of self-esteem, respect, motivation and well-being. Our evolving range of opportunities allows people to connect with others, achieve their personal goals and to make a meaningful contribution to their community through volunteering.
To live in hope is essential to us all. At Pillar, we understand how powerful personal stories of recovery can be as they touch and inspire us. Telling your story can be part of a healing process, inspire hope in people on a similar journey, and encourage practitioners to reflect on their everyday work. Pillar works in partnership with people with lived experience of mental illness to influence change. They are at the heart of Pillar's developing practice. We are grateful to the people using our service and their supporters who have generously and bravely chosen to share their stories. Through talking about our experiences, we are better able to understand and support each other. By working together, we can replace prejudice and assumption with respect and mutual understanding and challenge stigma around mental ill health.
The last of our 4 pillars, Young Minds, aims to support children and young people to learn about mental health, cope when things go wrong, know where to go for help, develop non-judgmental attitudes, and take part in community events. In 2017, following the need to reduce budgets, there was a redesign of community mental health services throughout Aberdeenshire. Pillar's service level agreement ended along with our funding. Pillar's closure appeared imminent. Long-term care and support throughout all stages of recovery had been rejected in favour of a model offering short-term interventions at the point where an individual met moderate to critical criteria. At this time, there was a lack of appetite from existing health and social care teams to work collaboratively with Pillar as a non-commissioned organisation, and referrals from these former partners ceased. However, our awareness-raising campaign within the community resulted in a significant rise in the number of people self-referring. Pillar's board of directors, which includes service users, argued that this new model of support would not meet the needs of those suffering from long-term conditions. To them, it was obvious that short-term support for long-term conditions was inadequate. They wanted to see a service which people could rely on and access at the time of need in order to effectively self-manage their conditions and prevent further deterioration or relapse.
We were now effectively in survival mode. It was agreed by our service users and trustees that we would access our limited reserves as closure of Pillar was to be avoided at all costs. We were now tasked with the mammoth challenge of, firstly, continuing to deliver a service with a 50% reduction in staff. Secondly, we conducted a full service review. Whilst we believed our model was sound, we recognised that there was room for improvement. Thirdly, We had to ensure our future. This was extremely challenging. As we know, funders like to see new projects and don't like paying for staff wages or running costs. And finally, we had to raise awareness of the need for recovery-focused self-management support services, which are not time-limited and can be easily accessed at the time of need. To make this even more challenging, we were working in a climate where weekly self-management groups were considered an expense, which merely encouraged dependency on services.
People with lived experience and their family members chose to respond by speaking publicly about the vital role that Pillar played in their recovery. Their contribution made it clear that the structure and routine of Pillar's model was reducing the demand on health and social care services and helping to prevent admission to psychiatric hospital.
We now had to find the best way to share this message with potential funders. Following evaluation and consultation with service users, their families and carers, and other third sector agencies, we devised our 4 pillars of wellbeing. This helped us to get our message across, and gradually we began to attract enough funding to secure our immediate future.
In August 2018, Aberdeenshire Health and Social Care Partnership announced their plan to create a new mental health strategy and began a series of consultation events. Pillar recognised that people experiencing mental health problems might struggle to attend such public events and may require support to engage in the process. With support from partner agencies, we hosted 3 additional events in order to ensure the voice of lived experience was heard. 2 months later, we received funding from the Alliance Self-Management Fund, which allowed us to build on the learning from the consultation events and to launch our peer learning programme. This programme was attended by 8 service users and facilitated by our senior support worker who had previously received support from Pillar. Together, they developed learning materials which contribute to our understanding of the benefits and challenges of peer support. This in turn helped inform future funding applications. 5 of the learners went on to become peer mentors, further enhancing our service and making it easier for people to access our group recovery sessions.
So just 2 months after that, we were invited to meet with the new mental health leads for South Aberdeenshire. At this meeting, they shared that their priorities were to review local mental health services. We were given the opportunity to share our vision, which we discovered strongly aligned with that of new health and social care team leaders. Our priority was to ensure that local people continue to have access to service which would help them to direct their own recovery at their own pace and within a safe, supported community of interest. For the first time, we felt that the voice of lived experience was being heard and respected. This meeting proved to be a catalyst for change, and a positive working relationship was established. We would like to thank the manager of the South Community Mental Health Team for the following statement.
As a new team manager to the South Community Mental Health Team, a priority for me was to review local mental health services provided within secondary care and looking at how this fits alongside services provided by our third sector partners and community-based organisations. An area that I identified for development was the streamlining of roles within the Community Mental Health Team, focusing on improved service provision for key areas of support provided by core social work and mental health officer staff. To allow for this streamlining, I identified Pillar Kincardine as a potential partner that we could work with collaboratively to meet the needs of our local mental health community. Much of the work undertaken by Pillar Kincardine is aligned to priority areas set within strategic frameworks nationally and locally. In particular, they have innovatively led work on self-management over recent years in South Aberdeenshire area. The self-management recovery groups they provide are extremely well received and undoubtedly aid recovery. Pillar work on early intervention and prevention. Reaching those experiencing the early stages of poor mental health has ensured recovery can be maximised, and this valued resource has undoubtedly contributed to a reduced need for hospitalisation.
So as you can imagine, it was encouraging to know that the Community Mental Health Team recognised the value of our work. As such, the team have recently begun working with us to co-deliver elements of our weekly programme, with the benefits being felt by both agencies. We believe this will significantly improve outcomes for both mutual clients and others we support. Over the last 2 years, Pillar has developed a mind and body self-management programme for women and are currently expanding this programme to include delivery of Living Life to the Full. Our social horticulture group has flourished over the summer and provides award-winning produce for our weekly meet and eat group. In addition, we continue to support peer mentors and volunteers to develop and run a local health walk. Pillar's social and educational programmes continue to help people achieve their goals by reducing isolation, building confidence and improving self-management skills, enabling them to feel valued members of their community.
For the past 2 years, we have worked to develop our programmes to include a greater emphasis on learning. Under the umbrella of the Mind and Body programme, we introduced 3 10-week programmes. Creative Minds, which focuses on a creative expression in which members are encouraged to facilitate sessions and skill share. Active Minds encourages increased levels of physical activity whilst peers support each other to explore community resources. And Healthy Minds, a psychoeducational programme which includes mental fitness workshops, mindfulness and the decider skills. We will continue to work with our partners in the community mental health team, peer mentors and volunteers to run Moving Forward, a next steps programme for those who have successfully completed the Mind and Body programme.
We're about to launch a Mind and Body programme for men. Initial stages will involve working with service users and volunteers to develop the programme prior to opening this up to the wider community. We're also excited about our plans to develop 2 formal volunteer work placements for those living with long-term mental health conditions. Ultimately, we hope these positions will include competency and assessment elements and will be a springboard for people seeking paid or unpaid employment.
Whilst we're extremely proud of our success, no means do we think we've arrived at our destination. That is a health and social care system that fully recognises and supports the role of the third sector in delivering improved outcomes for the people in need of support and care. While many of those on the front line understand the economic and strategic value of working with a co-produced organisation such as Pillar, those in senior positions appear reluctant to trust the voice of lived experience.
Thanks to our funders, Pillar will continue to work with our health and social care partners to deliver effective self-management programmes and addressing local issues. For example, hospital discharge planning, improving transition between services such as substance misuse and criminal justice. We believe our work is making a valuable contribution to the integration of health and social care at a local level. It is our hope that through our work with the Alliance, this learning will also make a difference nationally. Thank you.
Thanks to Moira and Gillian for that. That was a really interesting and thought-provoking look at the journey to integration, the strength of lived experience in that process and of partnership working. We are going to be putting some questions to Gillian shortly. She'll be with us soon. For the moment, we're going to just take a short break and we'll come back to you as soon as we can with questions for Gillian. Do I get to see the questions? And we're back with Gillian now. She's joining us for some of your questions. Gillian, hi, thanks for joining us.
Thank you for having us.
And congratulations on the award that you won at Self-Management Awards this week.
Thank you very much. We did. We're deleted.
Great. So we'll get on to some questions now. The first question we've had in is, how important is it to work in partnership with people and organisations that actually share your values?
Hugely important. I mean, it's vital. The differences that we are seeing as an organisation in being able to link up, it's got benefits to both sides. There's a benefit to ourselves in terms of being able to manage resources, and benefits to the organisations that we work with. Also, if particularly with the Health and Social Care Partnership, the Community Mental Health Team at the moment, it's just vital that the people at the centre of it have linked up services that are able to communicate with each other, and the focus remains around the person.
And obviously building those relationships and partnership is really important. What kind of key tips do you have for people in terms of building those relationships and getting all of that established?
I think what's been really good for us is having the people that we're talking to, you know, with our partners, it's getting a good understanding of their role and the challenges that they're working against as well, rather than just trying to battle your own challenges. If you understand the other perspective, then it's easier for you to work together. And I think we're always fighting our own corner and fighting our own needs. And I think it's about just making sure that the communication's a bit more positive than that, and there's a bit more respect for each other's challenges.
Yeah, and that must be key, is that respect and also being on a kind of equal footing in that terms as well.
At the end of the day, I think we're all working towards the same goal. We all want to support the people that we're working with and give them the best opportunities and the best outcomes. We may have different views about how that can be reached, but if we're not talking to each other and communicating well, then we're not providing the best service to the person at the centre of that.
And at the end of the day, it is about that person.
At the end of the day, that's what we're all there for.
Yeah, absolutely. So what are the key aspects to peer learning that make it so successful for supported self-management?
We've had done a peer learning programme. One of our senior support worker who had been in receipt of services herself at one point, led the learning on that. And it was about getting people together. Everybody has the best intention of being able to support each other, but it's being able to do it in a safe way and recognising what the challenges will be to themselves and to the other person that they're trying to support. And that those challenges will change from time to time. So the key learning has been that although the best intentions are always there, it's making sure that the support is offered and received in a way that is safe to everybody, and that's beneficial to everybody, and that the balance of outcome for that. If you're continually giving support, you're maybe depleting your own resources and becoming more in need of support. So it's finding the balances and having help to navigate your way around that sometimes. Is vital.
Really important to get that right for everybody involved.
Absolutely, and recognising that people go, recovery isn't a linear thing. People will have relapses or have good days and bad days, and supporting each other to recognise that not every response or every event is the responsibility of the person that's trying to help. It's dependent on where people are, and just having that level of understanding with each other.
And you spoke in the presentation about the fact that support isn't time limited, that this is a longer term form of support, and that is so important for people with longer term mental health conditions.
Absolutely.
And like you say, that recovery isn't linear, so important to have that support.
Absolutely. I think that's the thing that we hear most commonly and that people are most passionate about is the way to stay well is to know that if you start to dip, if you start to become unwell, we're teaching people to recognise the signs and symptoms of when they're becoming unwell again. And it's unfair to expect people
have to become so unwell or to reach a level of criteria before they can then access support to help themselves. And good self-management comes from being able to recognise those signals, those triggers, if you like, and then have somewhere to go to manage that, to head it off at past. That's how we talk about, we know that people have come to us and said, before I had this, I would have been in and out of hospital. I've had X amount of hospital admissions over the last few years, but having this place to come to and talk things through, or distract myself, or having these strategies and techniques, I'm able to manage that better myself now. And that isn't something that happens over a 6-week program or a 12-week program. It has to be available at the point of need. It's vitally important for people and their families to have the confidence that support is there.
And it's a lovely balance between the service you provide and self-management as well.
Yeah. I mean, we very much encourage people, when we know that people are doing well, in recovery, to share their learning and to support other people, and at the time where they are feeling strong, to be the leaders and the guides and the mentors, but knowing that they have when they need a service, it's always it's the balance of whether you're able to give or whether or in need of support, I suppose, really.
You spoke also in the presentation about the power of the voice of lived experience in the processes that you were going through. Tell me a bit more about that.
That's something the organisation has been a big challenge for us. We had members who were being consulted. There were various consultation processes happening, and people were being asked to voice their opinion. They were showing up in difficult circumstances sometimes to do that. They voiced their opinion, and then what was delivered was there was no reflection to that. It's okay. There was no what people were saying, or it was interpreted in a way that was not the way that it was interpreted for convenience rather than what people were actually trying to say. And what they were trying to say was, this is the type of service we want. We want ongoing, reliable service. And so when the consultation processes came round again, we found that people had consultation fatigue. People had consultation fatigue, and why should I engage in this process? Nobody's going to listen to us anyway. And we were also finding the design of consultations very often were mixing people with lived experience, or people who are still in receipt of services, with maybe round the table with other professionals, and that was very daunting and inhibiting, and people were finding it difficult to speak up. So it was making sure that there were safe environments for people to engage in that process, and then make sure that was fed back. And I think that we're starting to see the dividends of that now. We have better relationships with the other organisations because of that.
I think it's so important for people to feel empowered in terms of their lived experience as well, and that they are giving something to the processes really, and that they're having an impact.
Absolutely. I think our service is co-produced, and everything that we do, we're a user-led organisation, so we're constantly engaging people in what we do and shaping our service to reflect that. And it causes us to reflect on our own practice and to reflect on it's a healthy way of working, a very healthy way of working for everybody.
Yeah, it's fantastic. Thank you so much for your time today. It's been great to talk to you. Could talk to you so much more about everything, but we have to finish up now. So that brings us to the end of this week's webinar. Just a quick apology for technical problems there. We are out of our usual environment, so we've been encountering a little bit of trouble there, so apologies again for that. Thank you so much for being with us today and for sending us questions. Just before we go, a nod to another piece of work taking place at the Alliance that you may be interested in. It's integration stories, which are published on our website, shared on Twitter and shared in our e-bulletins. Integration stories charts examples in development and innovation in integration up and down the country. We would be really interested to hear from you on this, so do get in touch. Here are the contact details for us here at the Alliance, should you want to get in touch. We would love to hear from you. Thanks again for joining us this afternoon and for your questions. It's been a pleasure having you with us. Join us for the next Alliance Live webinar soon. We will look forward to having you there. Thanks again.